If caring is harmful, why would government care supporting carers?
Okay, that's a very
I guess it's always nice to have a nice. I don't know. It's yeah, it's an interesting way of looking at things. But I would like your view, and maybe I say my piece. Answer that too.
Well, look, I would have a cynical view about this, unfortunately. But so this is a very, very interesting, very witty question, I would say. So, I approach this from my kind of standard microeconometrician point of view. So what I wanted to do here is to identify precisely an effect on a question that I think it's relevant nowadays and to quantify this effect. Now, what does this mean in terms of policy making? Would the government reading these numbers would the government have any incentive to do anything about it, especially knowing that, as you say, that there's a mental health cost in providing care to people? My answer is no, probably no. So this is actually, paradoxically, this information would actually convince them about doing absolutely nothing about this, in a sense.
Well, I think, look, sorry to interrupt, but I think I would have answered. My position would be, I will tell it would be different, but yours is actually probably more. It certainly raises more fundamental questions than my, I guess, because the fundamental question you raise is that, well, we probably need to really understand what really works in mental health and focus on that, because obviously in COVID there has been an expansion in spending that might be proven, and we don't know yet, irrational or excessive or maybe not well targeted. We just don't know, but probably raises at least a reflection on that. So both the question and your answer I find very important. Well, the other is that probably, yeah, if you think in a more welfare analysis point of view, you would have to look at the aggregate dead weight loss from mental health, right? So if the carer still contributes to improve someone mental health, and that is leading to a reduction of his mental health, but in aggregate you're on top, then you're worthwhile doing. So a very good question. Actually, I thought it was a little bit less interesting, but with your answer, I think it's actually a very nice policy twist.